Let's talk about how to respond when a child is choking. Once a child is over 12 months old, we'll treat choking the same way we would for an adult, just on a smaller scale. Depending on their size, you may need to kneel on the ground to perform back blows and abdominal thrusts. There are two types of obstructed airways, partial and full. A partial obstruction is when the airway is only partially blocked. Some air is still able to move through the airway and the child is still able to cough. Their breathing is audible and their skin might be flushed. If a child has a partially obstructed airway, all we want to do is encourage them to cough and stand by in case it gets worse.
Keep coughing, keep coughing. You're doing really good. Doing really good.
Don't give them food or drink, don't perform back blows or abdominal thrusts, just encourage them to cough and monitor the situation. Ideally, forceful coughing is all it takes to dislodge the object. If a child becomes too weak to cough, their condition will rapidly deteriorate into complete choking. Call 911 immediately if you haven't already, and prepare to treat a full obstruction. A complete or full obstruction is when the airway is completely blocked. Air is no longer able to move through the airway and coughing is impossible. Now the child might be clutching their throat, they can't speak or cough, and their lips might be gray or bluish. They might also try to leave the room. Before you start treating them, introduce yourself and ask if they're choking. It's important to act quickly. Start with 5 back blows. Move beside the child. You may need to be on your knees. Reach your arm across their chest to the opposite shoulder to support them. Have them lean forward, and with the heel of your hand, give 5 hard back blows between their shoulder blades. If their airway isn't clearing, give 5 abdominal thrusts. Landmark by placing your hands at the top of their hips and then move around to just above their belly button. Make a fist and place the thumb side against the child's abdomen. Place your other hand over your first for extra force and thrust inwards and upwards. If they're still choking, continue with another cycle of back blows and abdominal thrusts until the object comes out or the child becomes unresponsive and you need to start CPR. Remember to always seek medical aid after abdominal thrusts or chest compressions.